Solve the problem. That's the message from a federal judge ordering the Alabama Department of Corrections to enter mediations and figure out how to properly house mental health patients inside Alabama's prisons.
ADOC admits in a lawsuit that prisons routinely house inmates with severe mental illness in restrictive housing units, not mental health designated housing, despite already being told by courts not to do that.
WAY 31 senior reporter Matt Kroschel joins us live outside Limestone Correctional this afternoon to break it all down for us. Matt?
Well, Marie, Dan, the court's ordering ADOC to come up with a way to comply with the court's previous orders involving those inmates and safety concerns inside restrictive housing inside Alabama's prisons, including the one here in Harvest. So inmates with serious mental illnesses are not supposed to be housed in restrictive housing unless there's an exceptional circumstance. But the court reviewed the weekly serious mental illness reports from ADOC, finding that each week between January 25th and July 26th of this year, an average of about 50 individuals with serious mental illness were detained in restrictive housing units in the state's prisons. The judge saying these figures gives him, quote, pause, and that ADOC's restrictive housing units suffer, quote, perhaps the most dangerous effects of severe understaffing and are unsafe for prisoners with mental health needs. An Alabama civil rights attorney working with several inmates on their cases right now against ADOC, reacting to the judge's orders.
First thing you have to do is stop it from getting worse, right? And so the bad situation that they're in right now is that they are not adequately treating mental health, in large part because they don't have enough correctional officers.
So ADOC's own reporting shows between 3 out of 4 and at times all of the inmates in a given week were detained in restrictive housing for longer than 3 days. Our sources telling us it's because they don't have enough staff inside these prisons to manage the mental health units. Now, the judge in his order on this issue says he wants to review it again at a later date. In the meantime, he is demanding ADOC finalize plans to launch an external monitoring team. It's made up of healthcare providers and others. The judge wants that oversight group in place so they can begin reviewing ADOC's mental health staffing ratios and make changes immediately. That was ordered years ago. ADOC has continued to not meet deadlines. Something not mentioned in today's orders, but things that we're hearing from current staff members within ADOC is that they are actually housing some of these mental health illness patients and inmates inside units that are set aside for other inmates who have physical injuries, keeping them inside the same cell because of the same staffing issues. They say this isn't just safe for the staff members, the inmates, but also for the contracted out healthcare workers that show up to work in places like here at Limestone to provide services. For now, reporting live in Harvest, Matt Kroschel, WAY 31 News.
Thank you, Matt.